Good morning, my dear children. Today we are going to study Social and Political Life, Chapter 2, Role of the Government in Health. In the previous class, you have already studied about the healthcare system in India, the types of healthcare available in India, and the facilities which are available to the people. Let us begin with the new topic, health and equality. As you already know that India is a democratic country, but the healthcare is not available to all equally. Here, the private services are increasing, but the public services not, and this is just because of made profit. Private services are concentrated in urban areas as well as they are costly too. Most of the people resides in rural areas and the public health facilities are not properly available there. Doctors are less interested to go and work in villages due to lack of facilities and profit. The cost of medicine is another issue. You already know that in our country we have the branded medicines as the generic medicines. But few doctors, just for their personal benefit, they used to provide branded medicines in their prescriptions. We would mostly find branded medicines. For example, the medicines are available in 25 rupees, but the doctors are prescribing of the cost of the medicine with the cost of 85 rupees. So, we already have learned about it. Now, only 20% of population can be the expensive. According to one study, 40% of the patients in hospitals have to borrow money or sell their possessions to pay for medical expenses. These are the drawbacks of the Indian health facilities which is available over here. Now, the cause of anxiety. Children, you just think of that, how the illness becomes a cause of anxiety. It is not always that the people who are rich only get illness, but also the people who are poor, they as well get the illness. They also do not have proper food and basic facilities available. The expenses or illness make their life difficult. Apart from that, we can also see that narrow-mindedness and conservative belief also prevent people from proper medication. Women, for example, are not taken to doctors in prompt manner due to narrow-mindedness or conservative view of the people. In many of the tribal areas also lack health care. In tribal areas, the hospitals are available, but they are placed far away from the zone in which the tribal communities live. And thus, even in the villages, the doctors were available. They are not the trained doctors, and thus you can see the condition of the people in the rural areas. Now we are really going to learn about the solutions. What could be the solution for such problems? Provisions of healthcare is responsibility of the government to all. Basic medical facilities should be available to all as it is closely concerned with the provision of basic amenities. Our country's government and people have to work together to improve the health of the nation. In that way, we are going to learn about the Kerala experience. I think you have learned also about that in Kerala, the number of literate people are comparatively more than the other part of India. In 1996, the government of state of Kerala gave 40% of its budget to the rural panchayat and the freedom to claim and provide for the needs in their villages. This led to positive changes as the amount was used for the better health provisions in the villages. For example, proper planning was done for basic amenities like schools, water supply, education, spreading awareness, etc. You already could understand that how the basic amenities like the cleanliness, the, the schools, the water supply, these are helpful for the people to be healthy. Not only that, as the person is educated, they can spread awareness and they are able to understand the things easily. So, automatically it becomes easy for the government to introduce several plans which is based for their health development. The another example is for you here is the Costa Rican approach. Costa Rica is one of the healthiest countries in South America. The main reason for this is found in the Costa Rican Constitution. Costa Rica took a very important decision to not have an army. This helped the Costa Rican government to spend the additional money on health, education, and other basic needs of the people. The Costa Rican government believes that a country has to be healthy for its development. It pays a lot of attention to the health of people. The Costa Rican government provides basic services and amenities like safe drinking water, sanitation, nutrition, and housing to its entire people. Health education is also considered very important, and knowledge about health is an essential part of education at all levels. Okay, so I hope that you understand the lesson. Thank you.